For most women, childbirth is a time for unbridled joy and happiness. Sometimes, though, complications might arise. This is what happened to 38-year-old Jane Jerry. Jane lost 1 liter of blood after delivery. This is termed as severe postpartum hemorrhage. Luckily, the midwives and nurses were able to detect Jane's condition on time.
Nilistuka tu venye nilisikia ati navunja damu sana nikashindwa. Ndio nikasikia wanaitishana maji. Walikuwa manasis wengi. Ndio wakakuja wakaanza sasa kuniangalia wakiniweka hizo vitu za maji. Sikuwa najisikia niko na nguvu. Lakini sasa after that kuwekwa hizo drips nikaanza kujisikia sasa at least napata nguvu.
She would later be managed at the facility and discharged the next day.
Niko sawa kabisa, niko salama, sina tatizo lolote.
This mother of 3 is among the many women who experience this condition during childbirth. In Kenya, about 5,000 maternal deaths happen every year. This means that at least 13 women die daily. 74,000 deaths happen annually in the world due to postpartum hemorrhage, a majority occurring in middle-income countries.
About 40%, that is 2 in 5, of the deaths happen because of obstetric bleeding. Majority of those deaths are due to postpartum hemorrhage.
Between 47 to 50% of postpartum hemorrhage does not get diagnosed, and this is attributed to lack of equipment to determine quantity of blood lost during birth.
We just look with our eyes, so it's a visual estimation that we make.
So unapata ya kwamba mwingine anaweza fikiria huyu mama amepoteza damu nyingi, mwingine naye anafikiria sio nyingi.
Most of the time are underestimating the blood loss, which means then we are not picking up postpartum hemorrhage.
Failure to identify postpartum hemorrhage early could result in multiple complications and ultimately death of the mother.
The blood doesn't flow to her kidneys, doesn't flow to the heart, to the brain. She may get acute kidney injury, and the last resort may be that we actually do what we call a hysterectomy, where we remove her uterus.
To detect and diagnose postpartum hemorrhage, a total of 14 facilities were equipped with this innovation known as a drape.
Wakati unazalisha mama, hiyo drip inakusanya damu yote ambayo ilikuwa inatoka kwa mwili ya mama. So na pia kwa sababu ilikuwa na the measurements, ungeweza kujua ya kwamba huyu mama amepoteza kiwango cha 200 milliliters ama ni 300, inakuambia kwamba huyu mama ako hatarini.
Health workers were armed with information through emotive, a systemic way to apply wholesome intervention in the event of postpartum hemorrhage.
We were able to reduce severe postpartum hemorrhage, which is blood loss more than 1,000 ml, which is a liter, or the woman having to go back to theatre to have an operation, a laparotomy, or dying. We were able to reduce that by 60%.
Like many other interventions, these too had its own challenges. The research revealed how some medication used for postpartum hemorrhage prevention failed to work.
Sometimes the drugs that we are getting, you'll notice a certain batch of drugs is not giving you the expected response, which would raise questions about quality.
Through this study, we have that evidence that there are certain products that are of poor quality.
There used to be a break in the cold chain for us, which then would affect the quality of drug that we were delivering to the patient. Occasionally, we would have issues of stockouts.
A breach in the quality of drug administered means that the mother could still be at risk of developing postpartum hemorrhage. The partners behind the research, however, tackled this life-threatening menace.
Once we were able to bridge those gaps of quality of what we are administering to the patients, we did notice a decrease in the number of mothers who are developing PPH.
With the research now over, health workers are back to visually estimating blood loss. However, there are guidelines that have been recommended.
Tungeomba sana kama drips zinaweza patikana. Inatusaidia sana kujua when to act.
Definitely increased our levels of hygiene in the department because each mother had their own drip.
We have to engage with the Ministry of Health and all other partners to see how do we now make this a usual product for us to be using on a regular basis.
Ben Kirira, K24, Health Beat.